This is Anthony King today, talking for Maverick Television. Today I'm going to talk about anxiety and the mental health issues that arise around anxiety. Sometimes these in themselves can be very disturbing and very derailing, and I think even though it's the year 2012 now, I think mental health still has a stigma attached to it. People worry about going mad, people even worry about being institutionalised, or going, at the worst, going to a Victorian mental hospital. Things like that always frighten people, and they're the stuff of films. We've all seen films, One Flew Over the Cuckoo's Nest, films like that where people have gone mad and it seems that there's no return from that. But if you look at the common mental health issues like anxiety and depression, these are the things that in this day and age are very treatable with drugs and cognitive behavioural therapy. Obviously when I say drugs I don't mean street drugs, but I mean drugs like anti-depressants, the common things like fluoxetine, Prozac, things like that can treat common mental health conditions, anxiety and depression, without much impact, and they're not addictive like the old-fashioned tranquilizers were. So when one goes to a GP with common mental health problems, it doesn't have to be that one would end up in a mental hospital or being sectioned. Now, being sectioned is what people fear the most. In addition to drug therapy and medication, there's a section of talking therapy called cognitive behavioural therapy, or CBT, which is a very popular and well evidenced form of talking therapy or counselling, for which people find great comfort and relief these days. It's very effective and it's been researched very well with randomised control trials, and it's known in conjunction with medication to have lasting effects and to uplift the person, especially again with common mental health problems such as anxiety, depression, bereavement, OCD, phobias, things like that. So there really is a lot of hope and help available. The first step is the GP, and if you're embarrassed about anything, sometimes it can be an embarrassing body symptom, but sometimes it can be an embarrassing mind symptom as well. And just because things in the mind can't be seen, that doesn't mean to say it's not as troublesome. Sometimes things that can't be seen obviously are more troublesome. So the first thing to do is get some help with the GP and try and go in the knowledge that you're not going to be sectioned, that things aren't going to go wrong. There's help available, there's lots of medications that aren't necessarily addictive, and there's talking therapy available, cognitive behavioural therapy and other things. So there's hope and help, and that's the way forward for today's mental health quagmire.